worn, chipped, and incisal edges of the lower anterior teeth can be not only unsightly, but also the patient runs the risk of breaking off a larger piece because of the sawtooth thin edges and having to have a more extensive restoration place than composite bonding. I'm going to talk about a very effective technique for bonding chipped, worn, incisal edges of lower anterior teeth. In this case, the patient was a severe bruxer, and you can see he's worn the tooth into the dentin of the tooth. You don't want to place composite directly on the tooth without some tooth reduction in a case like that. If you do, it will increase the patient's vertical dimension, and they'll be contacting only on those teeth. Plus, the restoration is not as stable as when you remove just a little bit of tooth structure into the exposed dentin with a very small round burr, or in this case, since the wear was so extensive, I was actually using a small diamond burr. I'm penetrating the dentin about, a half millimeter. You see, I'm preserving the enamel rim. I'm just reducing the dentin and creating a type of foxhole. I'm etching with 38% phosphoric acid, and you etch dentin for 15 seconds, and you can etch enamel for 30 seconds to a minute. So in these cases, since most of the preparation is in dentin, I'm going to etch for about 15 seconds. Suction off the etch and then rinse thoroughly for about 15-20 seconds. Placement of the primer adhesive is very important. Leave the tooth completely wet. Don't try to dry it. Don't suction off any water. Leave the tooth completely wet. Then when you use the little pledget to place the primer adhesive, as it goes into the tooth, it will displace the water, and the primer adhesive can then follow the water into the dentinal tubules to create the hybrid layer. The carrier, which is either acetone or alcohol, in the primer adhesive is attracted to water. So if you leave the water on the tooth and in the dentinal tubules, it will pull the primer down into the dentinal tubules, creating that really strong hybrid layer. Place 2x2s on the lingual side of the preps and blow all the wiggly or movable primer adhesive onto the 2x2 so that the final layer of primer adhesive is stable and it's not wiggling. It won't blow. Always cure the primer adhesive for a few seconds before you place your filled resin. In this case, I'm using flowable filled resin. Keep the tip of the filled resin in the material. Don't bring the tip out or it will incorporate air bubbles. So I'm placing this in layers. I'm following the flowable with a more viscous filled resin. In many cases, you can use only flowable. Since this patient was such a severe bruxer, I wanted a little more strength, and so I'm using the more viscous tube filled resin or composite. There's not much difference in the viscosity or the filled portion of flowable or non-flowable. You contour that to place with your spatula. Then I'm going to floss between every tooth. Finally, I'm going to cure each tooth 40 to 60 seconds. Then come back with a Shofu polishing disc, and I may also use a 30 fluted or 12 fluted diamond burr. Check the occlusion. It's very important that these patients wear a night guard following placement of the composite. Otherwise, they'll do the same thing to the composite that they did to their natural